When using a syringe, there are only a few minor differences when compared to the evacuated tube system. The advantage to using a syringe is being able to see blood fill the hub when the vein has been entered. Once the needle is in the vein, take care to keep it stable while the syringe plunger is drawn back slowly until the required amount of blood is drawn. The syringe method is also used to draw blood from arteries. Arterial punctures are not for the beginning phlebotomist. Extensive observation and training must be completed before an arterial puncture is attempted. Selection of the site is determined by circulation, size, accessibility of the artery, as well as the type of tissue surrounding it. The femoral artery is the largest artery. However, the radial and the brachial arteries are the only sites used by phlebotomists. Now let's look at how to perform a venipuncture using the syringe method. We begin by applying the tourniquet 3 to 4 inches above the draw site. Here we are looking for depth, diameter, and direction of the vein. After palpation, we remove the tourniquet. We cleanse the site using 70% isopropyl alcohol using concentric circles. While the alcohol is drying, we begin by assembling the equipment. We reapply the tourniquet. Remove the needle cap and remember to examine the needle for defects. Anchor the vein with a thumb and insert the needle at a 15 to 30 degree angle. A flash of blood will appear in the hub when you have entered into the vein. Brace your fingers against the arm to prevent movement when pulling back on the plunger. Pull back the syringe plunger slowly using your non-dominant hand. Release the tourniquet and cover the puncture site with a clean gauze. Remove the needle slowly and smoothly. Apply pressure or ask the patient to apply pressure. Activate the safety device. Remove the needle and dispose in the sharps container. Attach the blood transfer device to the syringe, holding the syringe vertically when advancing the evacuated tubes to avoid cross-contamination. Do not push on the plunger. Gently invert the tubes to thoroughly mix the contents. Discard the syringe with the attached transfer device in the sharps container. Examine the puncture site and finish by applying the bandage. Remember to thank the patient, remove your gloves, and wash your hands after the procedure.